everyone. Welcome to our podcast number 704. The topic is physical therapy. Welcome once again to Institute of Global Professionals International. So thank you so much, and I'd like to request all of our participants, please stay with us till the end because we have our speaker with us right now, and we hope that we expect that we will learn a lot from her. So I'm requesting all of our participants, please share this live in your timeline or newsfeed and invite your friends to our webinar. Yes, so and I hope that you all will have many takeaways and payoff from this webinar. Each time, don't forget to give a react and comment in our live webinar. Also, give a thumbs up to our Facebook official page and our new page for our junior learners, that is IGP Kids. And also, don't forget to subscribe our YouTube channels. So you can also share this live webinar in your uh, Facebook groups, all the Facebook groups, Instagram, Twitter, LinkedIn, and all the social media you are currently using. So invite at least your 5 friends and in our live webinar. So let's learn and grow together because we believe that power is gained by sharing knowledge, not holding it. So, dear participants, I'm your host for this session, myself, Nasrin Nishan, and okay, so you can also comment in our comment box with hashtag video skills, hashtag IGP. Okay, so we will proceed to our program step by step. So I'm requesting once again to all of our participants, don't forget to tag, share, and mention your friends in our webinar. All right, so today we have our speaker from Philippines, Ma'am Leah May Farilon Bertolome, and it's her. I think it's her second time here. Am I right, ma'am? Okay, she is a doctor in education, teacher in Capiz National High School, Capiz, Capiz, local physical therapist board examination, licensure examination for teachers. So let's welcome with a virtual round of applause to our honorable speaker. Hello, ma'am. How are you?
Hello, Nisha. Thank you so much for that very cordial introduction. I am so glad to be back here again in IGP and sharing another portion of my knowledge.
Yes, and we are waiting to learn from you.
Thank you. I hope we all learn a lot this noontime. Here in the Philippines, it's noontime.
Okay, so here is your slides,
Okay?
and you
So
can start.
before we continue on with our discussion for today, may I first invite you to please seek the Lord with me in prayer. Shall we all pray? Our Heavenly Father, we thank you for this wonderful opportunity that you have given to all of us, Lord, to gather together to learn and to grow and be happy in that learning. Dear God, this noontime or this time, wherever part of the world we are, may you help us, Father, that we will be able to open our minds and our mind and hearts and minds to be receptive of the message and the lessons that we will be hearing today. Help us to be knowledgeable in the aspects of our health and in the aspects of our personal care. Guide each one of us, Lord, and that we will all be blessed and we will be all inspired to know more about the things that are happening in our world. Thank you for everything. Bless me as I share this message and help me to be a light to the world and the beacon of your kingdom. We ask all of this in the loving name of Jesus. Amen. Hello, everyone. It is so nice to be with you again this morning or this noontime in the Philippines. It is a pleasure to be given another opportunity to be a resource speaker for this prestigious organization. It is an honor to be tasked to talk about a topic very dear to my heart. If you have followed IGP avidly, you'll know that this is the second time I talked here, and the first was about me being a professional teacher and the strategies to promote mental health in the workplace. By order, though, I am first and foremost a physical therapist registered in the Philippines before I became a public school teacher. Despite being a government employee, as a Tapas National High School teacher, I am still a practicing physical therapist and I see myself getting old in doing this noble and Herculean job. I graduated in March 2015 and became a PTRP after passing the local board examination last February 11 to 12, 2016 with a rating of 82.40%. Then, on the same year, on March 20, 2016, I took the licensure examination for teachers and passed with a rating of 86.60%. Still longing to progress my professional pursuits, I enrolled to take the certification to become a licensed massage therapist in August 2017. I got the third placer in the national licensure examination written for massage therapist. Recently, I graduated in Master of Arts in Education, major in Biological Science at West Visayas State University in August 2021. Currently, I am undergoing my doctorate degree major in Curriculum and Instruction at Guimaras State University. Being a professional is not new to me. To have one, you already shoulder a lot of responsibilities. But to have three, you can just imagine how I am juggling them. I am happy though, and I am practicing them all. I am even planning to add more. I am still young, and I have the future waiting for me. But among my life's achievements, what I am proudest and would like to be known for is being a lifelong learner, a passionate student, and a loving mother. For our discussion today, we shall have the following learning objectives, and you are expected to first, define what a professional is. Second, identify 10 qualities of a professional. Third, describe what physical therapy is. Fourth, inspect the extensive curriculum and training that physical therapists undergo. And last, which is the most important, is to contrast each physical therapy health conditions. Now, since we are on this page watching the live session of the Institute of Global Professionals, we must have ideas of what a professional is. To you, what does being a professional mean? According to Adobe Stock, a professional is a person who belongs to a profession, especially one of the learned professions or the ones that we attained from school and we graduated from. According to Annabel Connor, a professional follows an occupation as a means of livelihood or gain or is a person who engages in one of the learned professions. That's why some people might not be educated on that particular matter, but if they practice that and earn from it, they get gleanings on how to properly manifest it and become an expert in that field. Thus, they are identified as professionals in that field of expertise. According to my students, in general academic strand in our technological class last 2016-2017, I asked them the definition of what a professional means, and they told me that a person that has a special education, training, and skill in a specific activity that can become a paid occupation. A professional may also mean that they have the qualities of a skilled and educated person. Now, talking about the skills and qualities of professional people, what do they have? It is very important for us to note about this because we tend to forget what does it mean for us to be a professional. Sometimes we forget the proper etiquette and the proper things that we should be transacting with or we should be possessing. Now, according to Indeed.com, here is the list of the 10 qualities of professional people. First, they are reliable. Second, they are humble. Third, they have the etiquette or they know how to act properly in a given situation. Fourth, they are neat. Fifth, they are considerate. Sixth, they are dedicated. Then, they are organized. Eighth, they are accountable. Ninth, they have integrity. And lastly, they have expertise. These people that you see in your screen right now are people who are considered professionals. They may include but not limited to accountants, florists, brokers, bakers, realtors, doctors, nurses, physical therapists, lawyers, contractors, authors, and many more. So that is what a physical therapist or some of the things that are making us or hurting us because sometimes we are equated to massage therapists or chiropractors. But this morning and this noontime, we shall be studying about things that are true of what it means to become a physical therapy and they are contrasted from other professions. So we shall dig in and discuss deeply about physical therapists. According to Answers.com in 2016, the top 10 hardest board exam in the Philippines are by rank is the following. So the first we have law, second physician, third physical therapy, fourth chemical engineering, fifth accountancy, sixth architecture, seventh civil engineering, eighth electrical engineering, ninth mechanical engineering, and last is the pharmacists or the pharmacy exam. The third on that list is physical therapy, which is the highlight of our discussion today. Just imagine being included in that list and considered only as massage therapists and merely magic healers. It hurt us. That's why in today's discussion, we'll tackle issues to address that illiteracy and educate you on what we actually do as physical therapists. Now, what is physical therapy? Is it the same with massage therapists who only studied for 6 months to get that certification? Or with chiropractors who only took theirs for around 2 years? Or gym trainers who doesn't even need formal schooling? Now, what is this profession really? According to Answers.com in 2016, physical therapy is an allied medical career that focuses on promoting the patient's ability to move, reducing pain, restoring function, and preventing disability. Physical therapists work in many different settings and with many different age groups. These workplaces may include, but not limited to, hospital, rehab facility, skilled nursing facility, assisted living, home health, school, education or research, outpatient, sports medicine, and many more. From the OT potential, physical therapy is the treatment of the effects of the disease, injury, and disability by using exercise, manual therapy, education, and therapeutic activity. PTs are considered a conservative care option because they use such techniques to get results rather than relying on medications or surgery. Physical therapists' primary goals are to help patients improve their movement and function and also reduce their pain. Physical therapists often prescribe stretches, exercises, and functional mobility activities to help patients move more efficiently and effectively while eliminating as much pain as possible. Physical therapists also look at patients from a holistic lens, but they are generally focused on providing specific interventions to improve particular movements. According to the American Physical Therapy Association, physical therapists are trained and licensed movement experts. They can diagnose and treat a range of injuries, disabilities, and health conditions. Physical therapists aim to improve a person's range of movement and quality of life and prevent further injury or disability. Incorporating the things that I have learned and greatly influenced by our organization and administration class in college with Mr. Eliezer Katangay, I have come up with the following definition. Physical therapy is an allied medical health profession that evaluates patients and or clients for rehabilitation and or improvement of their quality of life and overall level of fitness by planning, organizing, directing, and controlling treatment programs and regimens through the usage of heat, cold, water, sound, electricity, therapeutic exercises, manual techniques, technological devices, and other physical agents available therein. Lastly, according to the World Confederation for Physical Therapy, physical therapy provides services to individuals and populations to develop, maintain, and restore maximum movement and functional ability throughout the lifespan. This includes providing services in circumstances where movement and function are threatened by aging, injury, pain, diseases, disorders, conditions, or environmental factors. Functional movement is central to what it means to be healthy. Physical therapy is concerned with identifying and maximizing quality of life and movement potential within the spheres of promotion, prevention, treatment or intervention, habilitation, and rehabilitation. This encompasses physical, psychological, emotional, and social well being. Physical therapy involves the interaction between the physical therapist, the patients or the clients, and other health professionals, the families, caregivers, and communities in a process where movement potential is assessed and goals are agreed upon using knowledge and skills unique to physical therapy. Now, what is the physical therapy curriculum? We have a very extensive curriculum because we study about anatomy and physiology. That's the reason why I took up physical therapy when I was in college because I want to be very good at anatomy and physiology before I became a medical doctor. That was supposed to be my dream. The second is we study about physical physiology, human biology, or you will become a very expert person regarding biology because you studied when we were in the third year college. We study about physics, biomechanics, kinesiology about movements, neuroscience, clinical pathology, behavioral sciences, communication, ethics, research, and other coursework required by individual schools. So in our school in Manila Adventist College, shout out to the people there, and we have studied orthosis and prosthesis and pharmacology. That's why we also know about the different medicines that could be incorporated in your problems, but we do not use medicine as our treatment. But we work with medicines to bring greater effects for you. But as much as possible, we would like to cure you using physical therapy agents without using medicines. Now, PTs are trained to do the following. According to the World Health Confederation, physical therapists receive training that enables them to conduct physical exam and evaluation of a person's movement, flexibility, muscle and joint motion, and performance, including finding out about their health history. They can give a clinical diagnosis, prognosis, and a plan of care with short and long term goals. Physical therapists are also movement experts and they perform physical therapy treatment and intervention. They can also give self management recommendations, including exercises a person can do at home. So these are some of the pictures or the snippets of how physical therapists works. These ones that you now see in your screen are the ones of us working to restore mobility and strength on the knee. The next ones are the ones working with children and amputees. Third slides are us working with stroke patients in hydrotherapy sessions or sessions done in water. And these last slides or the last pictures are an example of a rehab team. Two of the pictures are me showing with my fellow interns and clinical examples. The other two are grabbed from Google. So can you see me there? The one that is very sexy? Now, specialty areas. What can physical therapists do? Or what areas of medicine do we interact with? So, according to Wikipedia, physical therapists can provide supplementary treatment to a variety of medical conditions depending on their specialty. There are many types of physical therapy, and therapists often choose to specialize. These types and specialty areas include: first is the cardiopulmonary, second is the clinical electrophysiology, third is geriatric or for old people, fourth is wound management, fifth is neurology, sixth orthopedics, seven pediatrics or for young people, seven is eight is sports, nine is women health, 10 oncology or for cancer patients, 11 is for intensive care unit. But also, based on what I have studied in college and also right now, because I still go to seminars involving physical therapists, we can also be involved in research, in education, and in administration. Because we can also organize schools, we can also organize clinics, and we can be administrators. So, we will be discussing common health conditions that can be treated by physical therapy per specialty area. I hope that you will not leave me and you will not go to sleep or you will not eat and shut your phones, because noting that PT students studied these conditions for 5 years, and today in 60 minutes we will compress those 5 year learning, just so you know what are the conditions that can be addressed upon by physical therapy. So first on the list is the cardiovascular and pulmonary conditions. We have five. First is cystic fibrosis, second is pulmonary fibrosis, third is chronic obstructive pulmonary disease, fourth is myocardial infarction or heart attack, and fifth is post-coronary artery bypass graft. In cardiovascular and pulmonary conditions and rehabilitation, respiratory practitioners and physical therapists offer therapy for a wide variety of cardiopulmonary disorders or pre and post cardiac or pulmonary surgery. An example of cardiac surgery is coronary artery bypass graft. The primary goals of this specialty include increasing endurance and functional independence. Manual therapy is used in this field to assist in clearing lung secretions experienced with cystic fibrosis. Pulmonary disorders, heart attacks, post-coronary bypass surgery, chronic obstructive pulmonary disease, and pulmonary fibrosis treatments can benefit from cardiovascular and pulmonary specialized physical therapists. So the first on that list is the cystic fibrosis. What is it? Cystic fibrosis is an inherited disease that causes thick, sticky mucus to build up in the lungs and digestive tract. It is one of the most common chronic lung diseases in children and young adults and may result in early death. You know that you have cystic fibrosis if you have clubbed fingers or the normal angle in your nail bed are distorted. So you can see that in the picture shown. Poor lung function causes clubbing in people with cystic fibrosis. When the lungs aren't working well, the body has trouble pushing enough oxygen through the body, so the areas furthest from the trunk, the fingers and toes, may become deprived of oxygen. So we are trained how to conduct pulmonary physical therapy. So that is a very complex treatment, But if you have this condition, you can visit your physical therapy and be treated. Next is pulmonary fibrosis. Pulmonary fibrosis is a form of interstitial lung disease that causes scarring in the lungs. There are over 200 types of pulmonary fibrosis, and in most cases, there is no known cause. There is also no cure for pulmonary fibrosis, but we are treating the signs and symptoms, and we can help you live a full life. Current treatments are aimed at preventing more lung scarring, relieving symptoms, and helping you stay active and healthy. Treatment cannot fix lung scarring that has already occurred, but we can help you still live an almost functional life and an almost normal life. Last in pulmonary problems is the chronic obstructive pulmonary disease or COPD. Chronic obstructive pulmonary disease refers to a group of diseases that cause airflow blockage and breathing related problems. It includes emphysema and chronic bronchitis. COPD makes breathing difficult for the 16 million Americans who have this disease. Complications of COPD can become life threatening beyond just shortness of breath and limitations of activities to include pneumonia, heart disease, hypertension, cardiac arrhythmias, and congestive heart failure. Physical therapy can help improve movement of the spine, of the ribs, and extremities to make breathing easier while helping to restore function through gradual exposure to cardiovascular exercise. Next is the myocardial infarction. Is defined as a diseased condition which is caused by reduced blood flow in a coronary artery due to atherosclerosis and occlusion of an artery by an embolus or thrombus. Myocardial infarction or heart attack is the irreversible damage of myocardial tissue caused by prolonged ischemia or lack of blood uh, or an insufficient blood flow to the heart due to the narrowing of the coronary artery that causes chest pain or hypoxia. Exercise training in patients with acute MI can improve workload, functional capacity, test duration, and heart rate response, as well as promote the improvement of the cardiac pump function. Last on this category is the coronary artery bypass surgery or the rehabilitation after this surgery. It is also known as coronary artery bypass graft surgery and colloquially heart bypass or bypass surgery. It is a surgical procedure to restore normal blood flow to an obstructive coronary artery. Recovering from a coronary artery bypass graft procedure takes time and everyone recovers at slightly different speeds. Generally, you should be able to sit in a chair after 1 day, walk after 3 days, and walk up and down the stairs after 5 or 6 days. Most people make a full recovery within 12 weeks of the operation. Cardiac rehabilitation may start while you are still in the hospital or right after you leave the hospital. Cardiac rehabilitation programs usually last about 3 months but can range anywhere from 2 months to 8 months. Next category is the clinical electrophysiology. We have muscular dystrophies and peripheral nerve injuries in this specialty area. Electromyography for skeletal muscle studies are needed, such as done in muscular dystrophies and nerve conduction velocity tests in peripheral nerve injuries, and physical agents and wound management. Now, what is muscular dystrophy? If you watch the story or the movie or the K-drama Starlight, you will be able to know about muscular dystrophy because the main character there has a muscular dystrophy. This refers to a group of hereditary progressive diseases. Muscular dystrophy affects muscular strength and action, and some of which first become obvious in infancy, and others which develop in adolescence or young adulthood. The syndromes are marked by either generalized or localized muscle weakness, difficulties with walking or maintaining posture, muscle spasms, and in some instances, neurological, behavioral, cardiac, and other functional limitations. So we have the common types of muscular dystrophy. We have the Duchenne muscular dystrophy, and you can see in the blackened area the affected muscles. We have the Becker muscular dystrophy, the congenital muscular dystrophy, the myotonic muscular dystrophy, the limb girdle muscular dystrophy, the facioscapulohumeral muscular dystrophy, the Emery-Dufresne muscular dystrophy, and last is the distal muscular dystrophy, to name a few. So some are shown below with the main areas of muscle weakness. Next is the peripheral nerve injuries. A nerve injury can affect your brain ability to communicate with your muscles and organs. Damage to the peripheral nerves is called peripheral neuropathy or peripheral nerve injury. It's important to get medical care for a peripheral nerve injury as soon as possible. Early diagnosis and treatment may prevent complications and permanent damage. There are two commonly used classifications for peripheral nerve injury: the Sidon classification and the Sunderland classification. Sidon classification, as shown in the picture, is classified nerve injuries into three major groups: the neuropraxia, axonotmesis, and neurotmesis, whereas Sunderland expanded Sidon's classification to 5 degrees of peripheral nerve injury. Now, what are common peripheral nerve injuries? Now, you will always know this about this one. This is the carpal tunnel syndrome. So, this is the most common entrapment neuropathy. Female to male ratio is 4 is to 1. So, it is more commonly found in females. Carpal tunnel syndrome is caused by pressure on the median nerve in the transverse carpal ligament. The carpal tunnel is a narrow passageway surrounded by bones and ligaments on the palm side of your hand. When the median nerve is compressed, the symptoms can include numbness, tingling, and weakness in the hand and arm. The anatomy of your wrist, health problems, and passively repetitive hand motions can contribute to carpal tunnel syndrome. So, what do we do? Proper treatment usually relieves the tingling and numbness and restores wrist and hand function. Sometimes the muscle loses their belly, or it becomes little. Your hand becomes little because the muscle is severely compressed. That's why if you experience tingling and numbness in your hands, it could probably be a peripheral nerve injury named carpal tunnel syndrome. So go seek a physical therapy care. Next category is the geriatric category. We have geriatric physical therapy covers wide issues concerning people as they go through normal adult aging, but it's usually focused on older adult. There are many conditions that affect many people as they grow older and include but are not limited to the following. First is arthritis, second is osteoporosis, third is cancer, fourth is Alzheimer's disease, next, a fourth is hip and joint replacement. Fifth is balance disorders or vestibular dysfunction. Sixth is incontinence. Physical rehabilitation can prevent deterioration in health and activities of daily living among care home residents. The current evidence suggests benefits to physical health from participating in different types of physical rehabilitation to improve daily living, strength, flexibility, balance, mood, memory, exercise tolerance, fear of falling, injuries, and even death. It may be both safe and effective in improving physical and possibly mental state while reducing disability with few adverse events. The current body of evidence suggests that physical rehabilitation may be effective for long term care residents in reducing disability with few adverse events. However, there is insufficient to conclude whether the beneficial effects are sustainable and cost effective. The findings are based on moderate quality evidence. So first in the geriatric category, this is very common in people nowadays. This is having arthritis or the swelling and tenderness of your joints. The main symptoms of arthritis are joint pain and stiffness, which typically worsens with age. The most common types of arthritis are osteoarthritis and rheumatoid arthritis, but there are also arthritis such as ankylosing spondylitis, gout, juvenile idiopathic arthritis, psoriatic arthritis, reactive arthritis, septic arthritis, and many more. In our class before, I counted around 21 types. And we can help you. We cannot cure the arthritis anymore because this is part of aging. But we can help you lessen the problem that you are having. We can help you walk. We can reduce the pain without taking any medications. Next is osteoporosis. Osteoporosis causes bone to become weak and brittle, so brittle that a fall or even mild stresses, such as bending over or coughing, can cause a fracture. Osteoporosis related fractures most commonly occur in the hip, wrist, or spine. You can see in the picture that it is an osteoporotic bone and there is thinning of connecting bone and big spaces in the bone structure occurring, making the bone fragile. So at least we can help you with how you control your movement, how to control the pressure, and to avoid further injury. Next is Alzheimer's disease. So what do PT do with Alzheimer's disease? We can help you, we can listen to you, we can do therapy that is cognitive, but also when you lose the ability to perform functions, we can help you lessen the duration about that. So it is a brain disorder that slowly destroys your memory and thinking skills and eventually to carry out the simplest tasks. Now next is the hip replacement surgery. Hip replacement surgery, or called hip arthroplasty, is a surgical procedure to address hip pain. The surgery replaces parts of the hip joint with artificial implants. Hip replacement can address hip pain and stiffness for people with arthritis, avascular necrosis, and other form of hip joint damage. Recovery and rehabilitation help you restore mobility and return to activities with less pain. And as shown in the picture, physical rehabilitation will also help you in avoiding the potential risks of hip replacement surgery. Now, next is the vestibular dysfunction, or what is vestibular? The vestibular system includes the parts of the inner ear and the brain and process sensory information involving with balance. Vestibular disorders can be caused by a disease, injury, poisoning by drugs or chemicals, autoimmune causes, traumatic brain injury, or aging. Many vestibular disorders occur from unexplained causes. Symptoms of vestibular disorders include dizziness, vertigo, a spinning sensation, imbalance, tinnitus or the ringing in the ears, fatigue, jumping vision, nausea or vomiting, hearing loss, anxiety, and cognitive difficulties. Now, vestibular disorders are difficult to diagnose. It is common for a patient to consult four or more physicians over a period several years before receiving an accurate diagnosis. Over 35% of US adults aged 40 and older have had a vestibular dysfunction at some point in their lives. There is no cure for most vestibular disorders. They may be treated with medication, physical therapy, lifestyle changes, surgery, or positional maneuvers. In most cases, patients must adapt to a host of life altering limitations. Now, lastly, in this category is incontinent. Incontinence, or the involuntary loss of urine or stool in a sufficient amount or frequency to constitute a social or health problem. The heterogeneous condition that ranges in severity from dribbling to continuous incontinence. If individuals lose only one or two drops of urine when they don't want to, that's considered incontinence. And we can help you as physical therapists strengthen your pelvic muscles or the things or your sphincter control that are helping you defecate or urinate properly. Next category is wound management. In wound management, we shall be studying about wounds or discussing about wounds and burns. What are wounds? Wounds is a discontinuity or break in the surface epithelium. A wound is a type of physical trauma whereby the integrity of the skin or of any tissue is compromised. It is a separation or discontinuity of the skin, mucous membrane, or tissue caused by the physical or chemical or biological insult. So there are different types of burns. First, we have the superficial burn that involves only the epidermis. Sunburn is a good example of the first degree burn. Next is the partial thickness burn that involves all the epidermis and much more of the dermis. And lastly is the full thickness burn. It involves the entire epidermis and entire dermis down to the deeper layers, which is destroyed by coagulation necrosis. And I have patients before from the Los Santos Medical Center who suffered burns, and we are helping them recover after their surgery from the burn. Now, how do we assess burn? We use the rule of nines. The assessment of the area of burn is done following the rule of nines. The body is divided into 11 areas and each representing 9% of the total body surface. So from there, we can know how severe your burn is. Next, or the most many topics that we shall be discussing is the neurological physical therapy. It is a field that is focused on working with individuals who have a neurological disorder or disease, which is the first is our bread and butter in physical therapy. Right now, I have two patients who are I am treating from stroke currently, but before I have more patients because of stroke, and this is a very common problem, especially how hot we are experiencing these days and how unhealthy our lifestyle is. Also, we can treat chronic back pains, Alzheimer's disease, Charcot-Marie-Tooth disease, amyotrophic lateral sclerosis, traumatic brain injury, multiple sclerosis, Parkinson's disease, facial palsy, spinal cord injury. Common impairments associated with neurologic conditions include impairments of vision, balance, ambulation, loss in the activities of daily living, movement, muscle strength, and loss of functional independence. The techniques involved in neurological physical therapy are wide-ranging and often require specialized training. Neurological physiotherapy is also called neurophysiotherapy or neurological rehabilitation. It is recommended for neurophysiotherapists to collaborate with psychologists when providing physical treatment of movement disorders. This is especially important because combining physical therapy and psychotherapy can improve the neurological status of the patients because there are patients who are suffering from depression, especially if that is the affected part of the brain. That's why we have to be very careful in treating them and be very sensitive to them. We should not be invalidating their feelings. We should not be invalidating their conditions because the affected area here is the brain. That's why this category is very sensitive. Now, what is stroke? Stroke is a medical emergency that occurs when the blood supply to the brain is reduced due to either blockage or leakage of a blood vessel, resulting in to damage of brain tissue. Now, I know you are not unfamiliar of stroke, and a lot of patients starting from the hospital already refer patients to physical therapy right after the stroke because we have a gold standard in stroke. We are beating the time here. You must be treated within 6 months for you to receive maximum recovery. But if after 6 months you still have not recovered well, there are still minimal recovery that can be done, and there are researches that prove that you can still recover as long as you apply the neuroplasticity principles and you exercise and you do the treatment regimen that is being given to you. Now, next is the low back pain. Oh my goodness, this is also one of the most common problems of my patients or even clients or even my co-teachers or back pains, not just low back pain, but back pains, probably in the upper side of their body, on the mid back or also on the low back. Chronic back pain is defined as pain that constitutes or that continues for 12 weeks or longer, even after an initial injury or underlying cause of acute low back pain that has been treated. About 20% of people affected by low back pain develop low back pain within persistent symptoms at 1 year. So, what are possible causes of low back pain? We have non mechanical diseases process like kidney stones, and you apply heavy lifting, you have trauma, you have poor sitting posture. You frequently bend forward when you are watching cell phones and you cannot observe your posture anymore. Just doot, 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 and do cell phones. And we have degenerative conditions. So as you grow older, we cannot do anything already when it is a degenerative condition, but we can manage it. We can decrease the pain. We can still make you your function or your activities. And even without the medicine, we can help you experience relief on the pain and your activities. Next is the Charcot-Marie tooth disease. This is one of the most common inherited neurological disorder. CMT is a progressive disease of the peripheral nerves that causes loss of normal function and or sensation in the feet, legs, arms, and hands. CMT affects more than 2.8 million people worldwide. While not usually fatal, CMT can be severely disabling in some people. It does not have cure, but again, like many conditions, we can manage the symptoms so you can still live a full and normal life. Next is the amyotrophic lateral sclerosis. So this condition also has become popular because of the ALS challenge, bucket challenge. Do you remember that? So this condition came from Lou-Gehrig disease, is also known as Lou-Gehrig disease, from a very popular football player in the US. So it is a progressive nervous system disease. And as the normal cell, your muscle contract, but because of the nerve problem, it forms a sclerotic problem, so the muscles cannot contract. So this is progressive, this is also degenerative, but we can control the condition. We can lessen or prolong your life and live still a maximal life while you still have this condition. Next is the traumatic brain injury. Traumatic brain injury is defined as a disruption in the way the brain normally functions caused by a blow, bump, jolt, or penetration to the head. A TBI patient can also be managed by physical therapy by building physical strength, coordination, and flexibility. Next is the multiple sclerosis. This is a disease of the central nervous system that damages the protective coating around the nerve fibers known as the myelin sheath. This myelin is the one that is responsible in transmitting the messages to all parts of the body. This disease is considered autoimmune disease. So the bad cells of your body are eating the healthy cells in your body. This damage can often lead to a serious symptoms such as the following. You can have numbness and tingling, weakness, muscle pain, vision problems. In some people, MS can become aggressive and advance quickly. In other people, it can become mild and progress at much slower pace, with long periods of inactivity. In any case, physical therapy can be an important part of treatment with people with MS. PT for MS involves exercises to strengthen your muscles and improve your gait or how you walk, and your balance and coordination. It also involves stretches to help you maintain mobility and prevent muscle spasms. PT can also include training on how to use mobility aids like a cane, walker, or wheelchair. I also have a patient before having this MS condition. And she is already old enough. She is already a senior citizen. So you can see that because of physical therapy, her life has been prolonged and she is enjoying a better life or a functional life. Next condition is the Parkinson's disease. Parkinson's disease is a brain disorder that leads to shaking, stiffness, and difficulty with walking, balance, and coordination. Parkinson's symptoms usually begin gradually and get worse over time. As the disease progresses, people may have difficulty walking and talking. Although there is no cure for Parkinson's disease, medicine, surgical treatment, and other therapies can often relieve some symptoms. The role of physical therapy is to help you keep moving as well and as long as possible while enhancing your ability to move. So sadly, most neurological problems do not have cure, but at least we can manage the symptoms and we can prolong your life and we can help you enjoy your life for the better. Next is the facial palsy. Wow, this condition actually I have a former just a recent patient which I we already terminated because he is already satisfied with how our PT treatment resulted. So before he is having inability to wrinkle his brow, His eyelids are drooping, that's why he cannot close his eyes. He cannot puff his cheek, and the corner of his mouth is drooping. So this is different from stroke because stroke is only the lower quadrant of the face, quadrant, and it's either right side or the left side. But facial palsy, it's the whole side of the face. And one of the most famous artists, Justin Bieber, he has facial palsy because of a condition. So this term generally refers to the weakness of facial muscles. And although this is most commonly caused by a facial paralysis is the Bell's palsy, there are also other causes of facial palsy. And the treatment and prognosis vary greatly depending on the cause. Luckily, this condition has a cure and you can get well really. So, as I told you, I already discharged a patient who is very satisfied with his treatment program. So, what we do here is we do an electric stimulation, we do facial exercises, we also help with manual therapy, we massage the area, we help the area relieve the tension so that they can get back to their normal functioning. Next condition, which is one of a tricky condition and it has no cure, you will die with this, but at least as long as you do physical therapy, your maximum function that can be restored depending on the level of the damage can be ignited. So the spinal cord injury or the damage to any part of the spinal cord or nerves at the end of the spinal canal, it often causes permanent changes in strength, sensation, and other body functions below the site of the injury. If you've recently injured your spinal cord or the nerve that is passing on your backbone, it might seem like every aspect of your life has been affected. You might feel the effects of your injury mentally, emotionally, and socially. Many scientists are optimistic that advances in research will someday make repair of the spinal cord's injuries possible. Research studies are ongoing around the world. In the meantime, treatments and rehabilitation allow many people with spinal cord injuries to lead productive and independent lives. During the initial stages of rehabilitation, therapists usually emphasizes maintaining and strengthening muscle function, redeveloping fine motor skills, and learning ways to adapt to do day-to-day tasks. You'll be educated on the effects of a spinal cord injury and how to prevent complications, and you'll be given advice on rebuilding your life and increasing your quality of life and independence. Next category is the orthopedics. So we have seven. Orthopedic physical therapists diagnose, manage, treat disorders and injuries of the musculoskeletal system, including rehabilitation after orthopedic surgery, acute trauma such as sprains, strains, injuries of insidious onset such as tendinopathy, bursitis, deformities like scoliosis. This and fractures, amputations. This specialty of physical therapy is most often found in the outpatient clinical setting. Orthopedic therapists are trained in the treatment of postoperative orthopedic procedures, fractures, acute sports injury, arthritis, sprains, and the joint and spine mobilization manipulation. We have the dry needling or similar to acupuncture. We can do therapeutic exercise. We can do neuromuscular techniques, muscle re-education, hot and cold packs, and electrical stimulation are some of the modalities that we employ to expedite recovery in the orthopedic setting. And currently, I have a fracture patient post surgery. So we are rehabilitating her so that she will be able to get back to walking again and to do the functions of her hand, which had a fracture. So now let's discuss about sprain. A sprain is a stretching or tearing of ligaments, the tough band of fibrous tissue that connect two bones together in your joints. The most common location for a sprain is in your ankle. Initial treatment includes rest, ice, compression, and elevation. Mild sprains can be successfully treated at home, but there are conditions or sprain that cannot, especially to athletes, that sometimes require surgery. So after surgery, you will be referred to a physical therapy. Now, sometimes we are confusing sprain with strain. But we should remember that sprain is for the ligaments, while the next condition, the strain, is for the muscles. A strain is when a muscle or tendon or the tissues that attaches muscle to bone is stretched too far. A strain is sometimes called a pulled muscle. Depending on the level of muscle strain, it may heal within a few weeks, but re-injury can happen if you do not take care of your body. It causes pain and muscle weakness. It was actually 4 months ago. I have a strained patient, and in just 2 sessions, she became well again because she has become wary of the exercises I taught her, of the stretching techniques, and the manual therapy that we have done, and also the hot and cold packs, the electrical, and the ultrasound. The next is the tendinopathy. Tendons are bands of strong connective tissue that attach muscle to bone. Tendinopathy symptoms include pain, swelling, and reduced function. Tendinopathy is usually a type of overuse injury where the tendon is repeatedly strained until tiny tears form, so we can help with the healing. That's why we will help you recover from the pain that you are experiencing because of a tendinopathy. Next is bursitis, or the inflammation of the bursa. It is a closed fluid filled sac that works as a cushion and gliding surfaces to reduce friction between tissues of the body. The major bursae, this is the form of bursa, are located next to the tendons near the large joints, such as in the shoulders, elbows, hips, and knees. Bursitis is likely to improve in a few days or weeks if you rest and treat the affected areas, but it may return if you do not stretch and strengthen the muscles around the joint and change the way you do some activities. Next is scoliosis. Scoliosis is when the vertebrae form a curved line, which is in the lateral side, either to the right or to the left, or it can be right and left, so it could be an S shape. Sometimes they also rotate or twist like a corkscrew. Small curves usually do not cause problems, but a curve that gets worse can be bad for a person's health. Very large curves can damage the joints and cause arthritis of the spine. The Scroth method is a physical therapy approach to scoliosis treatment. It is based on exercises tailored to each patient's spine curvature. Physical therapists provide services and treatment during all phases of scoliosis. They help people function at their personal best. Physical therapists help people manage scoliosis during bracing and before or after any needed surgery. Your physical therapist will work with you and your child to develop and tailor a treatment plan specific to the type and severity of the scoliosis. They will work with you to help you reach your goals. They and your doctor will check progress throughout the treatment. So sometimes scoliosis can also be caused by because you are wearing heavy loads and you have poor posture. So that's why in sitting, let us always be careful to always move and to observe the proper posture. The next is fracture. The word fracture is the clinical term for a break in a bone. A fracture can range in severity from a hairline fracture, which is a small crack in the bone, to a compound fracture, where the broken bone punctures the skin. Bone can fracture crosswise, lengthwise, in several places, or in many pieces. Fractures are common home injuries, sports injuries, and workplace injuries that may involve the ankle, foot, hand, hip, knee, scaphoid, part of the navicular located in the palm, shoulder, or wrist. Physical therapy can help with healing and maintaining range of motion and strengthening the muscle. So right now I have a patient with a hip fracture and a wrist fracture. Last in this category is the amputation. Amputation is the loss or the removal of a body part such as the finger, the toe, the hand, the foot, the arm, or the leg. It can be caused by trauma, medical illness, or surgery. It can be a life-changing experience affecting your ability to move, work, interact with others, and maintain your independence. Continuing pain, phantom limb phenomena, and emotional trauma can complicate recovery. And physical therapists can be used in training the patients to be able to do their activities of daily living again. So sometimes your amputated area can be applied with an artificial appliance which substitute the anatomically missing component, or it can be an orthosis, which is an artificial appliance that supports the body part of the purpose of stabilization, support, or movement reminder. But right now, what do you see is an example of a prosthesis. The right foot and the right leg was replaced by a mechanical or artificial appliance because it was cut. The next category is pediatrics. Pediatric physical therapy assists in early detection of health problems and uses a variety of modalities to provide physical therapy for disorders in the pediatric population. These therapists are specialized in the diagnosis, treatment, and management of infants, children, and adolescents with a variety of congenital, developmental, neuromuscular, skeletal, or acquired disorders or diseases. Treatments focus mainly on improving gross and fine motor skills, balance and coordination, strength and endurance, as well as cognitive and sensory processing or integration. So the first is a cerebral palsy. I know this is a popular condition affecting the children. So we help here people to treat them that may include speech therapy, physical therapy, and occupational therapy to improve their physical functioning and learn ways to accomplish daily tasks. Medication may also be used to treat CP, and the use of assistive devices for mobility, communicating, seeing, and hearing can also be an important part of the CP treatment. Next is the spina bifida. It is a condition that affects the spine and is usually apparent at birth. It is a type of a neural tube defect. Spina bifida can happen anywhere along the spine if the neural tube does not close all the way. People affected by bifida get around in different ways. These include walking without any aids or assistance, walking with braces, crutches, or walkers, and using wheelchairs. People with spina bifida higher on the spine or near the head might have paralyzed legs and may use wheelchair. So we will do exercises to support their daily living. Next category is the sports category. So physical therapists are closely involved in the care and well-being of athletes, including recreational, semi-professional or paid athletes, or professional or full-time employment participants. This area of practice encompasses athletic injury management under five main categories. Now, I recently have a patient that I also discharged because she became well after 3 sessions of having a possible meniscal injury. So, the sports that injuries that we will discuss under the sports are ACL injuries and meniscal tears. So the ACL injury, I know that you are very familiar about this ACL, or the anterior cruciate ligament. This is one of the strong bands of tissue that help connect your thigh bone to your shin bone. An ACL tear is a common knee injury. It can happen to athletes who play sports like football, basketball, soccer, and volleyball, and to those who work physical jobs. There are surgical and non-surgical treatments. Most people recover from an ACL tear within 6 to 9 months. Next is the meniscal injury or meniscal tear. So meniscus tears are among the most common knee injuries. Athletes, particularly those who play contact sports, are at risk for meniscus tears. However, anyone at any age can tear the meniscus. When people talk about torn cartilage in the knee, they are usually referring to a torn meniscus. Many meniscus tears will not need immediate surgery. If your symptoms do not persist and you have no lacking or swelling of the knee, your doctor may recommend non-surgical treatment. But my patient, it's so funny, the doctor recommended her to have an operation even though it's just less than 2 months. But then I told her that let's wait first, let's observe. And in 3 sessions, the pain is almost negligible. She can already function properly. The muscle is very good with her strength and with the range of motion. So imagine if she accepted the doctor to have her operated, oh my goodness, she would spend a lot and then she will undergo another physical therapy session right after the surgery. The next category, or the second to the last category, is the women's health. So we have three: lymphedema, pelvic pain, and infertility. Yes, we can also solve problems such as this one. Women's health, or pelvic floor physical therapy, mostly addresses women's issues related to the female reproductive system, childbirth, and postpartum. These conditions include lymphedema, osteoporosis, pelvic pain, prenatal and postpartum periods, urinary incontinence, and but since the previous topics were already discussed, so I will only discuss these three. Manual physical therapy has been demonstrated in multiple studies to increase rates of conception in women with infertility. Now, let's discuss about lymphedema. Lymphedema refers to the chronic accumulation of lymphatic fluid within soft tissues of the body that causes swelling of the affected areas. It is usually identified in the extremities or the arms or the legs, but can be found anywhere in the body, including the face, oral cavity, neck, chest, and genitals. It is most widely identified in individuals with cancer, notably 1 in 5 survivors of breast cancer will later on develop lymphedema. Next is pelvic pain, or, or pelvic dysfunction. Pelvic pain can be a sign that there might be a problem with one of the reproductive organs in the women's pelvic area. Although pelvic pain often refers to the pain in the region of the women's internal reproductive organs, pelvic pain can be present in either sex and can stem from other causes. The treatment of pelvic pain varies by what the cause is, how intense the pain is, and how often the pain occurs. Sometimes pelvic pain is treated with medicines, including antibiotics if necessary. If the pain results from a problem in one of the pelvic organs, the treatment might involve surgery and other procedures. Physical therapy can be helpful in some cases. Physical therapists help people with pelvic pain restore strength, flexibility, and function to the muscles and joints in the pelvic region. Also, because living with chronic pelvic pain can be stressful and upsetting, studies have shown benefit to working with a trained counselor, psychologist, and psychiatrist in many cases. Now, lastly, about the uh, infertility. Now, well, what can physical therapy do about it? Infertility can be one of the most heartbreaking medical issues for a woman to deal with. But a new study shows promise in helping to treat infertility using a special therapy technique that's not only cheaper but also less invasive and easier than most traditional practices. They found that after they went through physical therapy, the women experienced a 40 to 60% success rate in getting pregnant, depending on the underlying cause of their infertility. The therapy specifically benefited women with black fallopian tube, polycystic ovarian syndrome, high levels of follicle stimulating hormone, and an indicator of ovarian failure. This specialized physical therapy has even helped patients undergoing IVF raise their success rates to 56% and even 83% in some cases, as shown in separate study. Lastly, the last category that we shall discuss is oncology. We have we will first discuss about the malignant diseases and the non-malignant diseases. Physical therapy in the field of oncology and palliative care is a continuously evolving and developing specialty both in malignant and non-malignant diseases. Physical therapy for both groups of patients is now considered an essential part of the clinical pathway as early diagnosis and new treatments are enabling patients to live longer. It is generally accepted that patients should have access to an appropriate level of rehabilitation so that they can function at a minimal level of dependency and optimize their quality of life regardless of their life expectancy. Now, physical therapy can help cancer patients restore function. The American Cancer Society recommends people undergoing cancer treatment and cancer survivors who perform consistent physical exercise to decrease fatigue and improve the ability to perform normal daily activities. Studies show that exercise can improve an individual's chances of surviving cancer. Physical therapists can design individualized exercise and treatment programs to reduce or prevent many cancer related problems. Physical therapists help people diagnosed with cancer before and after surgery. Non-malignant diseases. A tumor is an abnormal growth of cells that serves no purpose. A benign tumor is not a malignant tumor, which is cancer. It does not invade nearby tissue or spread to other parts of the body the way cancer can. In most cases, the outlook with benign tumors is very good. But benign tumors can be stressful if they press on vital structures such as blood vessels or nerves. Therefore, sometimes they require treatment and other times they do not. Now, we have discussed various health conditions that the physical therapist near you can manage. But in actuality, your physical therapists can do more. I hope that you have not slept or you have not taken a nap break while we are discussing the different physical therapy health conditions that you can have and your physical therapist near you can treat. I hope that you join us in educating others of the actual things that physical therapists do and how noble and Herculean this profession is. Know then that when you are in physical therapist care as your baby doctors, you are in good hands. This is Leia May Fancubila Farilion Bartolome, your physical therapist in service. Thank you. Nisha, back to you.
Thank you so much, ma'am, for sharing your knowledge with our participants. And this is, this is a great topic for this nowadays. And you have described it elaborately. Every point of your discussion is just, I think, will get benefited from this. Especially, I have question. I'll ask you in our Q&A session. So after the quiz, we will come back to you. And I hope that our participants is very interested in today's topic and they have learned a lot from this session. So thank you once again, Ma'am Leah, for sharing your knowledge with us. So, dear participants, now it's time for quiz. Yes. So I'm requesting everyone, please tag, share, and mention your friends in our comment box. And today, top 10 will be awarded with quiz completion. So after the short video, we will come back to our quiz competition. And after the quiz, we will move to our Q&A session with our ma'am. So get ready with your questions also. So enjoy the short video, and yes, we will share the joining link in our comment box. You can also directly go to Slido, give the code that is IGP. All right, so my dear lovely audience, this is our quiz competition segment. So you can find the joining link in our comment box. So you can directly go to Slido. And today's quiz code is ITP. You can also scan the QR code. Alright, so today top 10 will be awarded with quiz competition certificates. And please note that there is no connection between the quiz competition winner certificates and the international winner certificates. Yes, and right now we have 29 participants, 30 participants in this segment. So I'm requesting everyone, please mention at least your 5 friends in our comments. And after the quiz, we will back to our honorable speaker in our Q segment. Alright, so we will start our live quiz competition within a minute. So join with us, hurry up. Okay, so get ready and let's start. So the first question is on the screen. Physical, occupational, and speech therapy are examples of option number one, rehabilitative care, or option number two, intensive care. And you have 8 seconds left to answer here. Alright, the time is up. The right answer is option number one, and 88% of our participants got the correct answer. Congratulations. Alright, in our first round, we have Ma'am Angelina Velasco leading on top. Congratulations. Okay, so now we are moving to next question. How are mental and physical health connected? Option number one, physical health can affect mental health, and option number two, they are not connected. Correct answer is option number one, and 97% of our participants got the correct answer. All right, so right now we have Sir January Cindy leading on top. Following, we have Happy Madefu, Sir Alexander Alvarez, Sir Regan Teshoma, and I'm Charlene Kalahamaj. All right, congratulations once again. Those answered correctly. So now let's see the next question. Okay, so poor mental health increases the risk for long-lasting physical conditions like option number one, heart disease, and option number two, feeling sad. Okay, so the right answer is option number one, that is heart disease, and 91% of our participants answered correctly. Yes, and we have Sumohaki Malefu right now leading on top in this round. Congratulations. Now moving to next question, question number four. Which member works with physical conditions that impair the patient's ability to move? Option number one, physical therapist, and option number two, dentist. Alright, the right answer is option number 1, and all of our participants got the correct answer. Congratulations. Okay, so let's proceed to the question number 5. What do physical therapists do? Option number 1, perform a surgery. Option number 2, increase strength and mobility. Correct answer is option number 2, and 97% of our participants answered correctly. Okay, you can see the leaderboard result on the screen. Moving to next question. Which healthcare unit or facility provides therapies to regain physical and mental function? Option number 1, rehabilitation unit or rehab hospital, and option number 2, skilled nursing facility. Correct answer is option number 1, and 86% of our participants got the correct answer. Congratulations. Okay, so let's see the question number 7. Help with injuries or chronic health conditions regain their range of motions, manage pain, and improve quality of life. PT or option number 2, DV. So the correct answer is PT, and 89% of our participants got the correct answer. Alright, again we have Sir January Cindy leading on top in this round. Great. So let's see the question number 8. Medical company, dental lab, radiology, physical therapy are tasks organized under the blank, and so there are two options: treatment platoon and area support squad. Option number 2, platoon and area support. Correct answer is option number 1, and 97% of our participants got the correct answer. We have two more questions. Let's see the question number 9. What are two results to have a health career? Option number 1, job security and making a difference. Option number 2, practical and education. Correct answer is option number 1, and 57% of our participants answered correctly. Congratulations. Right. So now let's proceed to the last question. Question number 3. Which profession runs therapy sessions? Option number 1, mental health counselor, and option number 2 is psychologist. Okay, so 49% choose option number 1 and 51% choose option number 2. Let's see. And the correct answer is option number 1, that is mental health counselor. Alright. Let's see the leaderboard and our top 10 quiz competition winners. Wow, great. So congratulations, Sir Alex Xavier Alvarez. You are leading on top. We have Ma'am Leah Facundo spot on second, Sir Alan Huabuto spot on third, Ma'am Nika Jinna Javier spot on fourth. We have Sir Isaiah Kiangi Isaiah spot on fifth. Let's see the sixth spot. We have Sir January Cindy spot on 6, Ma'am Jamaline Rivera spot on 7, Sir Regan Tashomo spot on 8. Ma'am Girly May R. Del spot on 9. And finally, Ma'am Geraldine Kalahova, which is spot on 10. So congratulations to our top 10 quiz competition winners. Yes, so we will post your winner certificates to our Facebook official page after the program. Please collect your certificates. Yes. So congratulations once again. And now we are moving to our next segment that is QA with our honorable speaker, Ma'am Leah. So get ready with your question to us. And after this short video, we will come back with her. So let me remind all of you, don't forget to tag, share, and mention your friends in our comment box. Enjoy this short video. Hello, hello, ma'am. Welcome once again.
Hello, Nisha.
So yes, I have a question. For that, I'm requesting to our participants, please write down your question or your queries in our comment box. Okay. So my question is, you have shared about that physical therapy is nowadays it's need for our cancer patient. So may I know that is there any difference between the physical therapy and radiotherapy?
Oh, there is a big difference. Radiotherapy, you are using the radiation or a specific type of heat in treating the patients. You are killing the cells. And after radiation, it is physical therapy and radiation works hand in hand. For the patients to avail optimal function, uh, you have it is also good to be advised cancer patients to undergo physical therapy because after the radiation or the chemotherapy, depending on what their doctor prescribed them to undergo, they will suffer problems with their mobility, with their health, with how they wake up, with their function range of movement. So physical therapy can help with that. They can help
After
in
after
also
chemotherapy or after radiotherapy?
during. It can be
During.
during, it can be after. Yeah. Because the chemotherapy and radiation therapy, they are on schedule, right? Sometimes you will do it on the first week of the month and the next
Yes.
schedule is on the third week. So
Yes.
during after the first session, you can undergo physical therapy. You can do the exercises, how to improve function. Sometimes your PT will also help you. You go out of the house, you train with a PT, so that even though you are undergoing problems with your health as cancer patient, you will still live an almost normal life because you are engaging in a physical activities.
Yes. I think we have a question from Evelyn. When you're sharing your knowledge, let me find the question.
What's the
I think she
question?
asked about PT. Yes. What PT can do?
what PT can do. So that is what we have exactly discussed just this session. We can do a lot. We can improve. I have stated there the four different trainings according to the World Health Confederation of Physical Therapy of what we can do as physical therapy. We can conduct physical exam and evaluation of a person's movement, flexibility, muscle and joint motion, and performance, including finding out about their health history. We can give clinical diagnosis, prognosis, and plan of care with short and long term goals. We can perform treatment and intervention to answer your problems or the symptoms that you are experiencing. We can help you solve that. And we can give recommendations on what exercises you can do at home, which can help the specific problem that you are having. And I have discussed the different problems that you can have that your physical therapy can help you with. So if you have not been able to be with us during those discussion, you can have access later to this video and listen to that.
Thank you. And we have a question from Sarah Lanhua Brutus. Good day, Miss Leah. Do you have any idea how many degrees of scoliosis, okay, scoliosis can be
Scoliosis,
considered to, is
a
considered to avail?
PWD ka.
Yes.
Okay. Are you from yes, Brutas. I have a roommate before, Ate Beauty May Brutas, but right now she is married, so she has now a different last name. So you are from the Philippines. Actually, I have no idea on how many degrees of scoliosis, but I know that because I also have a PWD card from the Philippines because of some of my conditions, because I have already many maintenance meds. So the best thing is that you ask your doctor who are treating your scoliosis to give you a medical certificate. And then that medical certificate can also be considered that you are okay to be given a PWD card. So after getting a medical certificate from your private doctor or whatever hospital you are in, you can go to your local government unit or to your LGU. And then from the LGU, you can apply in the DSWD to get a PWD card. And then they will walk you through the process. They will still also inspect you. But the thing is, for scoliosis, if your degree of angulation is only less than 10 degrees, you are not considered to be scoliosis, or you are not considered to be sick with scoliosis, because 10 degrees or less than 10 degrees are considered normal degree. So for you to be considered a sick patient with scoliosis, it must be greater than 10 degrees. Okay, Alan? Or you can chat me, Alan, so that I can walk you with the process of how to get a PWD card.
Thank you so much, ma'am. I think no more questions in our comment box, but when you share your presentation, everyone, you know, taking it positively, they learned a lot from your presentation. They shared it through their comment.
Wow, thank you so much, Nisha. That's such a good thing.
Okay, so okay, we have a question from Sir Emmanuel. It's in CVA rehabilitation. What are the diversional therapy? Yes, yes.
Hello, Emmanuel. Thank you for the question. In CVA rehabilitation, actually, there are so many types of therapy that you employ. And I think this diversional therapy that you are thinking, you are saying, is actually a form of therapy where instead of focusing on the problem, we are solving what is left with the patient. So the thing is, if the patient is suffering from a left side problem, or left side of his or her body is not functioning, we will not focus on solving the problem alone. We will also focus on the right side of the body. So we will also treat the right side of the body. and that so that when the patient recovers, because if you are doing continual PT, you will also recover, especially if you are helping yourself. As I always tell my patient, they are the 80% of their recovery. So if they are not exercising, they are not helping me, they are not doing what I am telling them to do on 3 times a day or sometimes 5 times a day, they will most likely have a stunted development. But if they keep on doing it, they keep exercising, they will surely recover. So diversional therapy may also involve not just focusing on the problem, but also on the other part of the body that is not weak but must be strengthened to support the other part.
Okay, thank you, ma'am. So, may I know that to become a physiotherapist, which academic background you need?
You have to study Bachelor of Science in Physical Therapy. In the Philippines, it takes 5 years for you to study it.
Hmm.
So it's 5 year degree, and then you will take a board exam. You have to review for at least a year to take the board exam so that you can qualify. And then if you will practice in other countries, I think there are still certifications or exams that you have to take for you to be qualified. I don't know there in Bangladesh if you have if you have another exam to be taken to practice there.
Okay, so no more question. All right. So thank you so much once again, Ma'am Leah, for coming in our platform and sharing your knowledge with our participants. Okay,
Yes, Nisha. Can I make a shout out, Nisha, before we stop?
sure.
Can I shout out my co-teachers in Tapas National High School? Thank you so much for watching and for supporting me, especially to the persons who sent me pictures that they are watching. Sir Ronald Rosales, Ma'am Magdalene Grace Gayas, Ma'am Diana Rose Gaya, Mami Julie, Gloria Hamillarin, Ma'am Rita Sheila Palomar, Ma'am Willen Negarda, and Sir Ray James Puticar. Thank you so much for supporting me. And to the rest of the viewers who are so active, I cannot mention you all, but I actually have written them all. But I know that you are so blessed. I hope that you have learned a lot from our discussion today and you will continue on supporting IGP and learn more in the future.
Thank you so much, ma'am. Thank you once again, and I'm looking forward to another session with you. Okay, have a great day, ma'am Leah.
Yes, Nisha, thank you so much. You have a great lunch there in Bangladesh.
Thank you, ma'am. Okay, so dear participants, now we are moving to our certification process. So after this short Thanksgiving video, we will share the international letter. All right, so this is our certification process, and the program name is Physical Therapy Health Conditions. The code is IGP6519. Let me tell you once again, the code is IGP6519. You can take a screenshot or you can note it to your phone. Alright, so without this code, you're not eligible for certificates, and with code, you can claim your certificates anytime from our website. So, without an account, you can visit our website anytime, but you cannot do anything functionally. So that you have to create an account to our website. Yes, and our website address is www.eduigp.com. So visit our website, collect your certificates, and don't forget to celebrate with IGP. Once again, thank you so much to all of our participants who are still watching with us from all over the globe. And we believe that you all learn a lot from this session. Yes, thank you so much also to Ma'am Leah and to our participants for your cooperation and your participations. And I'm inviting to all of you to our next session this afternoon in Bangladesh. And till then, stay safe and stay happy, keep smiling, keep learning, and stay with us by your support. All right. Thank you so much once again. I'm Nasrin Misha signing off right now. Thank you, everybody.